Welcome on today's episode on my YouTube channel. Do well to subscribe, like, and share this video. Click on the notification button to get notified when I make a new video. We'll be talking about genital warts caused by the human papilloma virus. So this video will educate you more concerning this virus. Good morning, good afternoon, good evening, depending on where and when you get the video. My name is Chioma Bamara. Welcome to my YouTube channel. Welcome to my YouTube class. Today I'll be taking you on the topic of genital warts. You've been hearing of genital warts. I would like to take you on genital warts, the causes, the prevention, and also treatment. So before I would like to start, I would like you to subscribe to my channel, please, because I can't grow if you don't subscribe. I would like you to subscribe to my channel and also click on the notification button, like and share my video to save a life. I made a post concerning this genital warts caused by HPV, and I've been getting some complaints. This to show that this virus is rampant in our society today. So since 3 days I've been getting feedbacks on concerning this virus. So I would like to tell you about genital warts, but first and foremost I would like to tell you about the virus responsible for genital warts, which is the HPV. And HPV stands for the human papilloma virus. That's the most common sexual transmitted infection. So HPV is usually harmless and goes away by itself. But some types of HPV can lead to cancer or genital warts. So I'll bring you to where the HPV leads to genital warts. That's all you need to know about this genital warts. And genital warts are fleshly growths that develops around the genital or anus. So this results from one of the most common sexual transmitted infection. So genital warts are caused by infections with human papilloma virus. Like if you should come in contact with someone that is infected with the human papilloma virus, you will have genital warts. If the human papilloma virus, which is the HPV, if it doesn't go on its own, it might cause cancer or genital warts. So there is no cure for this infection, but there are various ways of removing the warts, which most method requires a person to see a medical personnel. And genital warts are just small growths that develops around the genital or the anus, and they are also known as venereal warts. So I would like to tell you, and these genital warts, they are warts formed separately or in clusters, and they may be small or less, you understand? And though in some cases they develop into a large masses, like they develop large. So these warts are usually skin colored or dark around the genital areas, and genital wart develops on the skin or mucous membrane in the genital or in the anus. So in the male, genital warts will grow in the penis, in the scrotum, or in the anus, while in the female it will grow in the vulva, in the cervix, in the vagina, and the rest of them. So genital warts are not usually painful, but they can cause itches, redness, or discomfort. It's not pleasant to the eyes, you understand? So an HPV infection does not always causes symptoms. It doesn't cause symptoms. Some people might be having this virus in their body system and they won't know about it, as there is no symptoms. So some people may have this infection and without developing the warts, may find the reason like I'm okay, without knowing they are having a human papilloma virus in their blood system. So for this reason, it is impossible to tell whether a person has a human papilloma virus except you conduct a test. So I would like to tell you on if the warts do disappear, it may be 3 weeks, several months, or even years, you understand, after the person has developed this infection. So some people might not get the warts immediately, but the HPV is in their blood system. They might not know no symptoms, as in the symptoms are not that, body system differs, and some people might not even observe the symptoms that they are having this HPV. So I will tell you on the causes of this genital warts, their causes. So these genital warts are being spread through sexual transmitted. Like if a person contacts it, it can transmit it through sex, and this HPV virus goes through skin to skin to genital contact, skin to skin genital contact, such as during vaginal sex, anal sex, oral sex. And some people have this infection but experience no symptoms at all, and it shows no sign. But they might not experience the symptoms, but the warts will just appear. So I would like to tell you the following increases the risk of developing the growth of this genital warts. Yeah, it increases the risk. Number 1 is having sexual contact without using a barrier protection, like using a protection of condom, female condom, and the rest of them. But I would like to tell you that condom is not 100% safe, and having other viral infections which is untreated. So having this viral infection such as HIV and HIVs can also increase the risk of having this genital wart. So I would like to tell you on at least a little preventive measures you can use to avoid this human papilloma virus that will lead to genital warts and the rest of them. So people that are sexually active, that they can reduce the risk of developing this genital warts in several ways. Like number 1, using a barrier protection, as I said earlier, such as condoms, I will not say condom has 100% assurance that you won't get this virus that will lead to genital wart, but at least it will save. Using barrier protections. And number 2, getting the HPV vaccine, like being vaccinated. You can get this vaccine in bigger hospitals, FMC, teaching hospitals, and the rest of them. Like being vaccinated can prevent a person from contacting certain types of virus, including those HPV and the rest of them. So it's advisable you get vaccinated to keep you safe from this virus. Understand? So it recommends that HPV vaccination for both girls and boys from the age of 11, 12, although it can be given as early as the age of 9 to save you from this HPV, the human papilloma virus. Why number 3 of it is limiting your number of sexual partners, like those that are active in sex. It's advisable you limit your number of sexual partners, because if you come to our country now in Nigeria, this human papilloma virus is rampant. Some people might have it and they don't know they have it. So if you are sexually active, it's advisable you get vaccinated. Even if you can't get vaccinated, you limit your number of sexual partners. You have to be confident in your partner before having unprotected sex, so you won't contact this virus. So it is also important for sexual active people, as I said earlier, to keep in mind that a person can transmit this HPV without knowing that they have it. So they might get it, and for years you just feel you are okay, not knowing that you are having this HPV in your blood system. So I'll be telling you on some symptoms. Body system differs. Yeah, the way my body system will react to some certain virus and infection, maybe yours won't react like that. So some people might not get these symptoms at all, and some people might get it at maybe their first or second week of getting in contact with this virus. So in men, these symptoms include the appearance of the warts. That's number one symptoms. If once you see the warts, you know that, yeah, this genital warts, and you are having the human papilloma virus in your blood system. So the appearance of the warts, unusual growth of that warts. You might just wake up one morning and you experience warts, and the warts will keep on growing. So you experience lumps around your genital area, your penis and the rest of them around your genital area. So you experience lump, you just wake up one morning and you see lump. And number 4 of symptoms some people will observe is sores. You just wake up and you see sore in your genital area. That is for the men. Then for the women, as I said earlier on, body system differs. So in some women might experience bleeding after sex. Yeah, that's number 1 symptoms. Bleeding after sex, and unusual discharge, just foul discharge, unusual discharge, as the discharge you are having is not like the way you used to have it before. And a lump in your genital area. That same lump the men notice, the women also notice it. And pains while having sex. You feel pains all around your genital area. Sex is meant to be enjoyed, but you feel pains all around your genital area. That is for the women. Some will observe these symptoms. As I said earlier on, body system differs. You might have this virus in your blood and you won't get any symptoms until you are being tested of it. You can go to the hospital and conduct a HPV test, bigger hospitals, and conduct HPV tests to know if you're having this virus in your bloodstream. And you can also get a test on blood MCS, like on your blood, you use your blood for a test. So if there is any trace of such virus, so it will be detected. So I will tell you on the treatment, and like, how will I put it, a treatment on this genital warts. And this treatment includes removal of the warts, but they may return maybe after the removal, you understand, and they might not return depending. So there is no cure for this infection, and this procedure of removing the warts include the topical medication, which a person will apply a cream and liquid directly to the wart for several days and weeks, so the warts will just fall off. That is topical medication, just applying of creams and liquid substance be given to you by a physician to the warts to help it fall off. And again is the cryotherapy. Like, the cryotherapy is applying a liquid nitrogen to the area and causing blisters to form around the warts, which eventually will help the warts to fall off. And this procedure is performed by a health worker. It's not something you do at home. That is the cryotherapy cryotherapy is not something you will do on your own. It has to be performed by a medical personnel. So we have the last treatment, which is the laser treatment. After the laser treatment, it's the surgery. So the laser treatment, a health worker too will perform this, and that is the removal of the warts with an intensive beam of light. Removal of the warts with a beam of light. You understand? So it's not something you will do at home and you expect it to go. It requires a medical personnel. And the last but not the least of the treatment is the surgery. So the person will receive a surgery. The person will receive a surgery with a local anesthetic before the surgeon will remove the warts. And the treatments are not painful but may cause sore or irritation. You understand? So it requires a medical personnel. It's not something you will do at home if the warts is there. So all those treatments is required. Once you notice there is a wart in your genital area, because it's unpleasant to the eyes. Once you notice there is a wart in your genital area, I will advise you to go to the hospital. It's not something you will do on your own. After seeing the medical personnel, might advise you for a tropical medication, which is applying of creams and liquid to the affected area to help the warts fall off on its own. So it will also require a lot of things: lesser treatment, cryotherapies, and surgery. So it's not something you will do on your own or something you will require herbs for. No, you need to remove those warts under a medical personnel. And I would advise you to get vaccinated. Once you are sexually active, I would advise you to get vaccinated. Also note that condom is not 100% safe from this virus, because condom will protect you 100%. Your genital might come in contact during the procedure and you end up getting them. So it's advisable you stay safe, limit the number of partners you have sex with, and also try to go to the hospital to perform the test to know if you are free from this virus, because I noticed this virus is very rampant now. So some people will be asking me on my DM on, is this a new virus? My dear, it's not a new virus. It's not a new virus. HPV has been there for long. You don't know about it. So it's advisable you go to the hospital, you test for HPV. If they don't have it, you can check for blood, MCS, and the rest of them. See your physician about this. Once you notice any symptoms, any itches, redness, and the rest of them towards your genital area, please see your physician. Thank you for your time. Thank you for giving me listening ears. I appreciate you. For the old ones, my subscribers, I say I love you. For the new ones that will subscribe, I say I cherish and adore you. Thank you for being with me. Your health is always my priority. Thank you.